Hey there. So as a direct support professional, you are on the absolute front lines of health and well-being for the people you support. But you know, one of your most critical roles is also one of the quietest. It's about becoming a health detective. Today, we're going to dive into exactly how you can recognize and respond to those subtle signs of illness and injury.
Okay, let's just jump right into a scenario. Picture this. Rachel, who you work with, almost always comes home from her program happy, maybe humming a little tune, but not today. Today she's withdrawn, she's crying, and you can just tell it's more than a bad mood. It's a clue. So, what do? What's your next move? Answering that question is exactly what we're here to figure out together.
So yeah, your mission, should you choose to accept it, is become a health detective. Now, this isn't about making a diagnosis. Leave that to the doctors. This is about being an expert observer. It's about realizing that your sharp eye and your quick action can make all the difference, and I mean all the difference, in someone's life.
At its heart, all of this detective work boils down to one simple but incredibly powerful idea: noticing when something is different. That little change you spot early on, that could be the one thing that prevents a major health crisis. You really are the first line of defense, and your ability to see what's changed can, and I'm not exaggerating, literally save a life.
Okay, so how do you spot something different? Well, it all starts with knowing what's normal. And I'm not talking about some textbook definition of normal. I mean their normal. What's their typical routine? What's their usual mood like? How do they act and communicate on a totally average day? Knowing that baseline, that's the foundation for everything else we're going to talk about.
So once you have a really good sense of that baseline, you can start gathering clues when things seem off. Every good detective needs a toolkit, right? And yours has two fundamental skills: really sharp observation and crystal clear communication. Let's break them down. Your first and most immediate tool is just your own senses. You're looking for physical changes. What do you see? Is there any redness or swelling? What do you hear? Are there unusual sounds like moaning or wheezing? When you're helping with personal care, what do you feel? Does their skin feel hotter or maybe colder than it usually does? And what do you smell? Any strange or unpleasant odors? These are the objective facts, the hard evidence you're collecting. Your second major tool is communication. This is the more active part of your investigation. Don't be afraid to ask direct questions like, "Can you show me where it hurts?" But it's also about listening. And I mean really listening. Not just to the words, but to the feelings behind them. And remember, communication isn't just a two-way street. Talk to your colleagues. Read the logs. Has anyone else noticed this change? You're piecing together the whole story.
All right, so you've gathered your clues. You've noticed a change, you've used your senses, you've communicated. Now comes the most critical part: deciding what to do next. You have to assess the situation and choose the right level of response. And the good news is, you don't have to guess. There's a really clear three-level system to guide you. Level 1 is what we call routine treatment. Level 2 is an urgent doctor call. And level 3, that's a 911 emergency. Knowing which bucket a situation falls into is one of the most important skills you'll develop. So let's start with level 1. Think of this as the green light level. This is for the minor stuff you can probably handle right there in the home. You know, a small scratch that just needs a bandage, an itchy bug bite, or maybe some swelling where you already have a doctor's order that says to elevate their leg. It's routine, but it still requires your careful attention and documentation.
Now we move to level 2, the yellow light. This is for serious signs that might not be immediately life-threatening, but they definitely need a doctor's opinion, and soon. We're talking about a fever of 101 or higher, a rash that seems to be spreading or getting worse, or a sudden, really out-of-character change in someone's behavior or their ability to move. These are all clear signals to get on the phone with a doctor. And finally, level 3, the red light. These are the situations where you do not wait, you do not second-guess. You call 911 immediately. We mean things like uncontrolled bleeding, any real trouble breathing, choking, or a seizure that lasts for more than 5 minutes. If there is any doubt in your mind, you make the call. Quick action here is absolutely everything. So you've assessed all the clues and you've made a decision about which level of response is needed. But wait, your job isn't quite done. What comes next is just as important: taking action and then documenting it. This part is totally non-negotiable. First, you have to act on your decision. Whether that means grabbing a bandage, calling the doctor's office, or dialing 911, you have to follow through. And then you must document everything: your observations, the actions you took, who you talked to, what they said. These two steps, action and documentation, go hand in hand. And when you're writing your notes, please follow these golden rules. Be specific and objective. Write down,
John said, "My chest hurts." Not, "John seemed like he was upset about something." See the difference? Record facts, not your opinions or interpretations. And this is a big one. Never, ever try to make a diagnosis. Your job is to report the signs and symptoms, not to be the doctor.
Okay, before we wrap up, let's put a quick spotlight on a few common but high-risk conditions where your detective skills and your quick actions are especially critical. Let's just quickly run through 3 of these. First, choking. The universal sign is someone clutching their throat, they can't speak or cough. Your immediate move is to start first aid, like the 5 and 5 method, if that's part of your training. Next, seizures. You'll see uncontrolled muscle movements. Your number 1 priority is safety. Clear the area around them, protect their head, and get them on their side if you can. And finally, skin breakdown. Be on the lookout for redness or sores, especially over bony spots like the tailbone or heels. Prevention is key here. Frequent position changes and keeping skin clean and dry.
Whew, we have covered a lot of ground, haven't we? From observation to response levels to specific conditions, but I want to bring it all back to the single most powerful tool you have in your toolkit.
I want you to really let this sink in. Your technical skills are so important, but they are all built on the foundation of your relationship with the person you support. Here's the quote. "In order to recognize a change, you must first know the individual and what is normal for that individual. Knowing their baseline, their little quirks, their daily rhythms, that right there is your superpower." So when it really comes down to it, the number 1 tool in your whole detective kit is simply you. It's your relationship, it's your observation, and it's your commitment to that person's well-being. That's what makes the difference. And that's really what it's all about. So, as we finish up, I'm going to leave you with a question to take with you into your next shift. Who will you get to know just a little bit better tomorrow? Because that knowledge is the key to everything.